Hello, Miss Ahmed. How are you doing today?
Fine.
My name is Leandro Lopez. I'm a student physical therapist and I'll be working with you today. Before we get started, let me go ahead and clean my hands. So how's that arm doing today?
It's doing well.
I can see that. I can see that we're actually making some progress as well as when comparing the measurements in your chart. So that's great. We can actually progress to the next stage, which is compression bandaging. I just want to tell you a little bit about compression bandaging, all right? This is going to apply some pressure to your limb, about 30 millimeters of mercury, and that's because these are a short stretch bandage, so they have a working pressure. And this means that when you're working as a waitress or when you're with your little 2-year-old handling him, this is going to help work with your muscles to promote circulation of the fluid and maintain this size reduction as well as promote further size reduction. All right? But before I actually do anything with those, I just want to review your chart with you. I can see that your cancer is in remission, so that's great. And blood pressure levels are normal. You're not having any heart or lung problems, are you?
No.
Okay, you haven't broken any bones since we've last met. That's great. And this is a hands-on procedure, so I'm going to have to touch you. Is that all right?
Yeah.
Okay, so next what I'm going to do is just perform a quick skin check, and this is something you should do yourself daily. And what I'm going to be looking for right now, and what you should look for as well, is any kind of small insect bite wounds, any cuts or bruises, any open lesions. I want to look for any kind of bruises or warmth in the area that may be indicative of an infection, all right? And you don't know of anything that could have happened recently that would have caused an infection, do you?
No.
Great. Next I want to just do a quick sensory test. So I'm just going to slightly stroke you just like that, and you're going to let me know whether you can feel it or not, except you're going to do it with your eyes closed. So can you go ahead and close your eyes for me, please?
Yes. 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 Yes.
Alright, great. So go ahead and open your eyes for me. Because this was a systemic problem, I just wanted to check everywhere. Alright? So now there doesn't seem too many problems, so we can actually go ahead and get started. What I want to do first is apply this stockinette, and what this is going to do is help protect that arm, because we're going to be applying a bit of compression to it, alright?
Okay.
So, aside from helping promote some fluid return, these bandages are also going to provide some support as well. So I'm just going to take your arm now, and then I want you to pay attention to what I do, because in time, after you learn how to do this properly yourself or someone close to you, they're going to be doing this wrapping procedure as well. I'm going to start off by applying the stockinette. That's good. I'm going to roll this up here. You're going to see why in a second. And I want to make sure the top here is about 2 fingers below the axilla. It's a little high, so I'll just bring it down just a little bit. Alright, 2 fingers below the axilla, just the way we want it. And now I'm going to apply this finger wrap. Okay? So go ahead and relax your hand for me. Try not to flex or extend at all. Alright? If I need to move your hands, I'll do so. Alright, go ahead and relax that hand for me. Good, thank you. And I want to make sure this doesn't bunch up here, so I'm going to slowly move my way up as well. You're not experiencing any tingling or numbness in your fingers or hand, are you?
No.
Good. Again, to make sure this doesn't bunch up, I am going to move my way up. Alright. Your fingers don't look blue, so I think we're still good. And I'm just going to move upward. Make sure nothing was too tight anymore. Alright. So go ahead and turn your hand over. Alright, and relax. See, see how there's an open palm? That's just how we want it. Can you make a fist? And relax. I also want to see how there's no gaps or spaces or skin exposed. See that? Good. Slide your thumb through here. And next, what I'm going to apply is a bit of fluff. And what this is going to do, it's going to help even out the size of your arm, because as you can see, your arm up here is a little bit bigger than it is down here. So this is going to make it more uniform throughout, so that when I actually apply these short stretch bandages, it's going to apply more pressure down here than it is up here. That's going to help with the fluid return and the promotion. So what I want you to do now is make a fist and come into my stomach just like that. Alright. And I'm not going to apply this tightly. This is going to be applied on loosely, alright?
Okay.
Go ahead and relax here. There you go. Move your head to the side. Thank you. Do you mind if I just do this? Alright. That is just how we want it. So next, go ahead and relax your arm here. So what I'm going to do now is actually apply the compression bandage itself, alright? So after anchoring it, I can go ahead and cover that palm now. And you can use a finger eight method or cover half the width. I like to cover half the width just because it's easier to apply and it looks more uniform. And some strategies I want you to know when you leave here today to help prevent lymphedema is to just wear this all the time, even when you shower, because you're going to have a special cast, or you can even use a special plastic bag just to cover it and keep it dry while you do shower. Alright? And remember, when you showered, avoid those excessively hot temperatures, because that can also aggravate the edema. Alright, and now that this ended, I'm going to make sure to use tape to secure this and not anything else. Alright, and since that did end, I'm going to go the opposite direction, right here. And once that's insecure, I can go up one more time. Can you bend your elbow for me? Great. The elbow, I'm just going to make a little X pattern. Alright, and like I was just saying, avoid hot temperatures, so no more hot tubs. I know how nice they feel though. And another thing is, excuse me, after you shower, we're actually going to be the ones who take this off and clean it when you come back in next time, at least until you can properly wrap this yourself. Alright? And when you do shower, after you're going to be using moisturizers. Try and use something that's hypoallergenic. Something with no harsh perfumes or dyes would be best. And this looks really good, so can you open and close your hand for me? Can you bend your elbow? Is there any pain, tingling, numbness? Great, that's how we want it. And I know it looks pretty, but no more jewelry or tight clothing that can be restricting. This garment and that other compression garment you have is your new jewelry. And you want to make sure to wash those as well on a delicate cycle and air dry. Okay? So if you don't have any more questions for me, that's all for today, but please don't hesitate to call your doctor or myself as well. And with these garments, you're going to make sure that you only use them for about 6 months before you return them. Okay?
Okay.
That's all. Have a great day.